Want me to go ahead and let people in?
I think so, yeah.
Yeah, we got 24 people.
I have 7 o'clock.
Okay.
Yeah.
That's not true. I should not. I didn't get that. The wrong thing. I didn't mean to unmute everybody. I do that with the kids. I got to come back and find you guys. Sheila, Wakesha.
Hello.
Okay, I've got to unmute y'all. I'm sorry. All right. I'm going to get us started. So welcome everyone. It's so wonderful to see you and have you with us today. Sorry, I might be a little hesitant to admit people to the meeting. So anyway, welcome to Ignite Your ADHD Superpowers, Stay Motivated During COVID-19. I am Kate Franch. I'm the Outreach and Grants Coordinator at Camperdown Academy. And with my partner in this series that we've been doing all year, Caroline Fritz, who's the Executive Director for Children's Advocacy of South Carolina, we say hello. Yes, Caroline, I'm going to do a little bit of the introduction. Caroline will sort of take the rest of the meeting, facilitate it, and wrap us up at the end. So Caroline and I have been working all year on a series of workshops focused really on the superpowers of ADHD. We started the year with an overview of ADHD and then wanted to drill down into more topic-specific workshops. And so we've held one on ADHD in the classroom and also optimizing brain health. And we were in the midst of preparing a workshop that would focus on parents and families when this pandemic hit. And so we sort of regrouped and said, now what can we do? And realizing that the struggles don't stop because we're sheltering in place. In fact, in some ways, maybe they were exacerbated. Let's try a virtual workshop. So here you are, you're joining us for our kickoff. So bear with us because we're learning what this might look like, what model is going to be good, but we're hoping that we're going to have another sort of series of workshops while we're all in this together. So we pulled together a wonderful panel of local experts, and I will be introducing them in just a minute or two. But when we first got together, we thought, now, I've got somebody echoing a little bit. What can we talk about, right? Where to start? And we know that parents are finding themselves as teachers, sometimes for the very first time in a very specific way. And you might be wondering, even if you're a teacher yourself, it's very different when you're trying to teach your children at home. But how do I motivate my child when his or her routine has changed so significantly? Layered on top of that is that parent-child dynamic that is very, very different from the teacher-student dynamic. So I gotta admit a couple of other folks. So that's our topic for tonight, is motivation as a kickoff topic. We're gonna, again, as I said, start very simply with a panel discussion, a bit of screen sharing, you see, and then there will be actually time for you to interact with our panelists. Let me see what, following my agenda here. So let me just tell you the flow for tonight. Again, I'll do a welcome and introduction. Jennifer Massey, who is our featured presenter tonight, will do the presentation about motivation. There'll be a few minutes, a chance to Q&A with her about the information, the material that she has covered. And then we'll open it to a facilitated discussion with our panelists, and Caroline will moderate. And then we'll wrap up a few minutes before 8. So let me introduce our esteemed panel. And these are the panelists that are going to be with us for whatever this series looks like. And we will just probably rotate through them in terms of who will be the primary speaker any one evening. So we'll start with our main presenter tonight, Jennifer Massey. Jennifer received her BA in psychology from the University of Northern Colorado with training at Curtin University in Perth, Australia, and her Master of Social Work from the University of Alabama. She's been licensed by the South Carolina State Board of Social Work Examiners since 2002. Her professional experience includes clinical practice at public hospitals, public schools, community outpatient clinics, and services for child development disorders. She is experienced in treating childhood disorders and individual marriage and family issues. Jennifer co-founded Ministries, a Greenville nonprofit focused on making private mental health therapy accessible to the public. In 2011, she developed the Challenging Horizons program, an evidence-based model for students with ADHD in the private practice setting. Jennifer is passionate about service because it is the first career children experience, and it has significant impact on their second career. Her co-panelists are Wakesha Fogle with Wake Academy and Consulting. Wakesha is a devoted educator of almost 2 decades and co-founder alongside her husband Emmanuel of Wake Academy and Consulting in Greenville. She coaches both students and educators to excellence as they circumvent challenges and maximize opportunities to ensure that all students experience an extraordinary education. Wake Academy offers academic coaching and mathematics tutoring services to children from elementary through 9th grades. And in her role as lead consultant for Wake Consulting, Wakesha creates and enhances academic advances serving nonprofits, school districts, and schools across the Southeast as a math specialist and development coach. Welcome. And if you've been to any of our other Wakesha has been a panelist in almost all of them. Have you back. Also joining us tonight will be Suzanne Siman. She's with the Carolina Center for Counseling and Behavioral Interventions. Susie received a Master of Arts in Christian Counseling from Gordon Conwell Theological Seminary, licensure as a licensed professional counselor. She currently has an independent practice within the CCBI. Susie enjoys working with children and families with diverse needs through group and individual sessions. She feels that family involvement is integral to the success of the child and strives to assist the family in developing knowledge and skills to reach their potential. Her areas of interest include difficulties related to adoption, attachment, trauma, aggression, ADHD, Asperger's, anxiety, depression, and autism spectrum disorder. And then finally, Dr. Sheila Woods with Greenville ADHD Specialist. Dr. Woods is a board certified pediatrician who's been practicing medicine for over 39 years. She completed her undergraduate and medical school education at the University of Kentucky, as well as her pediatric internship and residency. She was selected to participate in additional training in child and adolescent psychopharmacology, offered by the Department of Child Psychiatry at Columbia. Her work has included private practice in general pediatrics for 14 years and academic work as an associate professor of pediatrics for 18 years at the University of Kentucky. And she has provided clinical care with an interest in child abuse, adolescent medicine, and developmental and behavioral pediatrics. In 2012, Dr. Woods opened a specialty practice in Greenville, providing evidence-based diagnosis and treatment for children, teens, and young adults with ADHD and related conditions. Subsequently, she expanded Greenville ADHD specialists to include care for adults. Sheila feels it's the highest privilege for families to allow her to evaluate their most precious family members to help alleviate the struggles they may experience. So that is our wonderful panel, and we are going to get started. I'm going to turn the screen over to, sorry, still adding people here, to Jennifer Massey to get us started with a look at motivation.
All right, thank you so much for having me and for being here this evening. I am hoping to provide some information to you that may be inspiring to you during this challenging time. We are going to talk about the ADHD motivation continuum. You'll see an infographic here in a minute. This is something that I learned working with ADHD students in the Challenging Horizons program. It's a broad, generalized framework of motivation. It's not going to be your behavior chart that you've probably tried a dozen of. It's going to be a 3,000-foot view of motivation, so that hopefully you will see some places in your philosophy of motivation that you could make adjustments, and you could really specify how to motivate your student based on where they are on the motivation continuum. So it will be helpful for you to see this continuum now. We could share that.
Mm-hmm. Hold on a second, I'll pull it up.
And we can make this available for you on their website as well.
Can everyone see it?
Yes.
Okay.
So it's the ADHD motivation continuum because I learned it from working with students with ADHD. I also live in an ADHD household, so I apply these principles on a daily basis. This motivation psychology really applies to all people, not just ADHD, but they definitely inspired my understanding of motivation from this perspective. I'm also going to offer you some guiding statements of how to maneuver in the motivation process. And so there are a lot of myths going around about motivation, some popular psychology, some how we were motivated as children. People use a variety of things that aren't necessarily evidence-based. And the reality of motivation is it requires some really essential executive function skills. Two of the executive function skills that motivation requires is the ability for a cost-benefit analysis, and also the ability of time orientation, to be able to look back in the past and see the effect of a decision and apply that to the present, and then look forward to anticipate the impact of that decision in the future. So what we know about ADHD is that it has delays for executive function. So what I like to teach people is that people without ADHD drive an automatic transmission brain, and with ADHD, they drive a manual transmission. They have to manually put these executive functions into play so that these seemingly automatic processes will take place. They're really not automatic in anyone. The executive functions are more automated than in ADHD. So the guiding statements are ways that we can manually put motivation into play for our ADHD students. So there are 3 factors, this is not on your handout, but there are 3 factors involved in motivation. Repetition, doing something over and over again produces a motivation to continue it. Restriction, what will happen if you don't do the behavior, and reward, what will happen if you do the behavior. So I can get anyone to do anything if I can maneuver those 3 variables, okay? So motivation is complicated, not in the concept of it, but in the application of it. It's really a delicate dance. Okay, when do I apply restriction and reward, and where is the best place, and when is the best time? And that's what I end up coaching people the most on, is the delicate dance that's involved in applying motivational theory. So I'm going to show you that motivation is a process. Okay, it's a process that can go forward and backward, and in fact it does go forward and backward. And we can apply these 3 variables to make it go in a direction that we want it to. So the concepts today aren't going to solve all of your problems for sure that you might be dealing with right now, but I'm hoping that they will kind of inspire you to think differently about a challenge that you might be experiencing. So the 3 variables are repetition, restriction, and reward. So let's take a look at the diagram. You'll see the student's thoughts. So this is how a student is thinking about a task. Okay. They're also going to be expressing it, but not necessarily in these words. They'll be saying something like, I'm tired, versus I don't do it. I don't want to do it. Okay. So the flow is the process from left to right. So we're looking at unmotivated on the far left, and then we're looking at self-motivated on the far right. Okay. And so in between we're going to move from extrinsic motivation to intrinsic, and you'll see how we get to a self-motivated process. So the bottom parent statements, these are the guiding statements that you can use to move your student based on where they are. You have to start where they are. And these are guiding statements that you can make more specific and move them to the next stage of motivation. So one thing about motivation is we do go through these stages sequentially. So nobody goes from unmotivated to self-motivated. Even if it looks like they did, they went through some of the stages in between. So we want to start where they are, and we want to set a goal to just get them to the next stage of motivation. And then once they've gotten to that stage, we want to nurse that in that space for a while, and then we want to move them to the next stage. And then we want them to adjust to that stage and move them to the next stage. So it's kind of like, increasing the temperature of boiling water. You don't really realize that it is getting hotter because you're adjusting along the way. And that's where that repetition of the behavior plus restriction and reward combination produces the motivation to continue a behavior independently. So let's take a look at this process as if it were columns. So there are about 6 stages, right? If there were columns in between each of the circular arrows. So the first column is unmotivated. And that is the student that doesn't want to do, whatever it is they don't want to do. Not doing it, all the excuses. So in order to get from unmotivated to extrinsically motivated, you want to use a guiding statement generally that says, I will agree to that when you start doing this. So there's a restriction and a reward in that statement. You're going to reward them when they start, but you're going to restrict them as they refuse. Okay, so you have an example of this might be, I will upgrade your phone when you start doing your laundry. And a real world example, adult example, is unemployment benefits. You will get benefits when you go through an application process and follow the expectations that we have. So that's what moves people to this next stage of motivation, which is the first stage of extrinsic, which is, I only do this to avoid consequence. And this is not a bad place in motivation. It's really kind of the beginning of being motivated. So in order to keep somebody in this stage, you want to give them a restriction and a reward, a guiding statement that generally is, you can go after you complete this. So this is something that we've learned a long time ago, right? So you can go play outside after you've picked up your toys. And so, of course, when that's enforced, then they're motivated by these consequences. So what I observe is, unfortunately, we don't really get students off of this level of motivation. They can get stuck there, and we have to continuously provide these consequences or restrictions, which gets really exhausting and tiring. So if you want to move them from the consequence avoidance stage of motivation, you have to offer them the next stage guiding statement. So what would make it worth your time? You want them to think about, I'm willing to do this for a reward. And the reward has to be significant to them. So it has to feel like an adequate compensation. It can't be something that you feel like is adequate. They have to feel like it's an adequate compensation for their time. So a real world example of this is paycheck, right? So we go to work not just because we get paid, but because we feel like we get paid enough. And if they decided tomorrow that they just wanted to pay you what they wanted to pay you, you would think twice about whether you would go. So in this stage of motivation, you want to ask them, what would make this worth your time? And then, of course, they may ask for the moon, and then you will have to negotiate for a night under the stars. So there's a negotiation process if they ask for something a little big. Here's an example. Let's say that your teenager, you want them to start being more motivated, and so you want to ask them, what would it be worth to you to come home and get your chores done when you get home? Well, I want you to buy me a car. Okay, so now you know what they're willing to work for. But that's a really big reward. So you want to negotiate down to, how about I schedule driving lessons? And when you find a reward that they're willing to work for, you want to apply that reward to get them on this stage of motivation. So sometimes we think of this as bribing, but it's part of the process of motivation, and it's an important stage in the process. In order to get off of this, some people might be worried about getting stuck on having to reward all the time. In order to move to the next stage, you want to offer the reward intermittently. So once they've been doing it for a while, it's now an obligation. You know, I do this out of obligation. It's just easier to get out of the way. So I just come home and get it done. So the guiding statement there is that I want to reward you for sticking with the tasks. Good job. Here's an extra $10 this week for doing your chores. So you want to continue the reward, but on an intermittent time frame. That's really rewarding to the human brain and will keep them in this obligation motivation. If you keep that intermittent reward system going. The next stage of motivation is that they start doing something because they like it, or they continue doing something because they like doing it. They found a personal reason to engage, that they're successful at it. It's not as hard as they thought it was going to be. And so if you want to move them out of the obligation reason for motivation into the enjoyment for doing the task, you want to add your personal praise and recognition. And recognition keeps people in the stage of liking doing what they're doing. So a real world example of this is Employee of the Month, or the academic awards that schools give. So recognition and positive praise are how to guide someone from obligation to liking what they're doing. And then the final stage of motivation is where they become self-motivated. And at this point, they're encouraging others to do what they're doing. They think it's so worthwhile, and so do that they're ambassadors for the tasks. So if you want to keep them at this self-motivation, then you want to provide them recognition and credibility. And credibility is expertise in the task. That they're recommended. They're recognized as an authority. That they have even the ability to help others. And that's going to help students stay in this stage of self-motivation. So even if they become self-motivated, it's possible for them to regress on behavior and become less motivated. So even if that happens, we use the same principles and guiding students to lead them back to a self-motivated state. Not everybody's going to get to a self-motivated state in everything. Sometimes we do things out of obligation, and that's okay too. But wherever your student may be on a task in the motivation continuum, I hope that you have some information that can help you to manually maneuver through this process. I'm taking my questions about it. It's been difficult here.
Hi there. So thank you, Jennifer, for that information. We do have some challenges with our audio. So hopefully, as we move through this, folks will be able to understand. We've had a little bit of issue with cutting in and out a little bit on the audio. So bear with us. We would like to take questions at this time for Jennifer. So you all could use your chat function and input questions. What we're going to do is allow you some questions to clarify the information that Jennifer shared. And then we are going to open the mic for our other panelists to weigh in. And we've got some other discussion questions planned. So I'm looking at the chat function now and looking for some questions here. And as I'm doing this, let me see, are there ages you expect kids to be able to move along the motivational process more easily than others, or does this continuum apply to all ages?
Yes, so this continuum applies to all ages. What is different in each age group is the rate that they can move up the motivation continuum and how far they can get up the motivation continuum. So as children get older, they have a wider capacity to become intrinsically motivated, but certainly young kids have the capacity for intrinsic motivation as well. So it applies to all ages.
Wonderful. Wonderful. How about a student with an emotional issues, someone that shuts down or afraid, or feels that they can't complete a task? And I know having a son with ADHD is a common issue that we have to deal with.
Mm-hmm. From a motivational standpoint, and there are several factors that could be going on in that, but staying on the topic of motivation, from a motivational standpoint, I find that those students are really stuck in the kind of consequence driven motivation. And so if there's a reward that can get them through a section of the work, whether it be a break or whether it be some interaction time, but it has to be something that they would view as rewarding. So you can get a student unstuck that's really stuck in a fit or a shutdown, if you can move them from the consequence stage to the do it for a reward stage.
Okay, so and I apologize for the echo. I'm not sure why that's happening. I'll mute myself after I give another question here, but the question was about functions that are required for motivation. You mentioned there were two of them?
Yeah, there are more than two, but two prominent executive functions for motivation. For a person to self-motivate, they need to be able to do a cost-benefit analysis. They need to be able to weigh what is the benefit of this action, what is the cost of this action. And then they need to be able to move through time orientation. It's called hindsight, insight, and foresight. And hindsight tells you the last time I didn't do this, this is what happened. So that's decision forming. And then insight is telling you this is what it would take to do this right now. And foresight would tell you the benefit of choosing to do something. So those are processes that take place when someone is motivating themselves and when executive functions are delayed or there's a deficit. That process can happen, but it's not automatic.
Okay, so I'm going to unmute again. We're getting a lot of questions on the echo that we seem to have, and it seems to have gone away. So another question that we had were around guidelines on what kind of things make good, helpful, or effective consequences and rewards.
So one of the things that is really popular and close to accurate is what the student perceives as a restriction and as a reward. So around their preferences, restricting their preference, you know, the variables that you have are all the resources you provide, right? So you have, you can restrict time, you can restrict freedom, you can restrict toys or devices, you can restrict activity, you can also reward with the very same things. And so I think a guideline for restrictions and rewards are what most parents are intuitively doing is they're looking for what preferences their student has. And those are how you want to restrict and reward in order to motivate them.
So at this time, that seems like the last of the questions for clarification. And we can, and I'll continue to monitor the questions as they're coming in. But I wanted to open the floor to our other panelists. And to ask what examples do you all have? What other examples do you all have of motivation and reward systems that you've seen work successfully with our students with ADHD that don't seem to have that intrinsic motivation? So Dr. Woods?
Hi, everyone. Thanks for coming. And I know it's painful with the breaking up, but I do think it's important to point out that kids who do have ADHD often have delayed emotional development pathways in their brains, often 2 years to 4 years behind their peers. And so when Jennifer is talking about the continuum of the motivation, it's important to recognize that an 8-year-old child may really be more like a 6-year-old child, and a 6-year-old child expectations on a motivation continuum is different than an 8-year-old's expectations on that motivation continuum. And so the question that was asked about what are some good ideas for rewards and limitations or consequences, whatever we want to call them, it's really the parent who knows their child the best and knows where their child is on that emotional development spectrum to be able to determine what reward might work best for. And you gave some great examples, Jennifer. And an adult, for example, is motivated sometimes by a paycheck, but for a child, money may not mean anything, although for some kids it does. And then moving them from the intrinsic, the extrinsic motivation, in other words, me standing over a person asking them to do their schoolwork, moving that to the point where they become self-motivated to do their schoolwork is a journey and a process, and it just doesn't happen overnight, and often is delayed when you compare your ADHD child to other children of the same age.
Might I add something as well? Can y'all hear me okay?
Yeah.
Okay, I'm going to take this from the perspective as a parent and as a career educator and dealing with middle school babies. But one thing I did with one of my children, and this just happened to happen, y'all, when one of my daughters was in middle school and she did something, and I was really at a loss as to what I should do as a consequence. And this came about, and it was absolutely phenomenal, and I've used it with other children, my own and others, and that was for us to sit down and literally I got out some paper and I was just like, okay, what's like something that's like a minor like offense or something that you can do that's like not like super crazy. Give me some ideas of what those are. And so I kind of listed them. And now give me some things that are like really terrible if you were to do this. And you can kind of break this down academically or even behaviorally, even with things that they're doing in the home. What's something that's a really bad thing, like if you did this, this would just be extreme. And so then I said, well, what would be some consequences? What do you think a consequence is something that's minor? And then we kind of just took different and it was a conversation that actually evolved into my whole family talking about those tiers, if you will, of different behaviors and a consequence that they felt would be associated with it. And I was amazed to find that my children's consequences were more extreme and harsher than mine would be. But it was an eye-opening experience for us as a family to collectively come up with what are some things that they felt, and then we can go in and say, okay, so you have agreed that you feel if this happens, that this is a consequence. And I agree with that, or I might put a little bit of some clarity to it, but there's ownership there. And I think that's the big thing with, depending on what age your babies are, there has to be a degree of awareness and ownership in it and dialogue and consistently doing so. When we bring in things externally, that's awesome. That gives us a framework, but we have to kind of sell it to them, you know, because if you're selling them the wrong flavor juice, they're not going to want it. So we got to flavor that juice up a little bit in a way that they feel like, okay, I understand and my parent understands what I'm going through. And lastly, in catching them incrementally when they're doing things that are positive and negative, incremental. You can't be so passive and let them just do all this other stuff. You got to catch them in a moment, and in that moment then go in and say, okay, I noticed this. It's not the end of the world, but let's go ahead. So I love this when you think of, you know, don't despise small beginnings. And that's when you're thinking about when it's going in a positive way and also when it's going in a negative way. So dialogue, y'all, catch them when they're doing things and praise them. Oh, I noticed you did this. Oh my gosh, that's a building block towards you doing this. You're doing it. Come on. I know you could do it. And that's going to give them and help build that intrinsic motivation, because now they have a greater awareness of their actions. And, you know, it's just a, like, yeah, Dr. Woods said, it's very incremental and small. So I hope that helped a little bit.
That helps a lot, Wakesha. Thank you for sharing. And I just want to reiterate that, how important it is to praise our ADHD kids, all our kids, when they're doing good. Catch them being good, I think someone commented. We tend to be hard on ourselves. You know, we take things personally, and we can be really hard on ourselves. And it's when we feel good about ourselves that we can really perform. So finding those opportunities to praise is really important. Some more chat messages are coming in. I wanted to, first of all, I want to point out this resource that many of you have probably seen in the chat message here from Ashley W. And that's the Rankin, that's DUNN-Rankin, RANKIN, Reward Preference Inventory. Check that out for some suggestions on what might be rewarding to your child or your student. And then I also saw a question, I'm looking for it now, around electronics. So what is, maybe one of our panelists, I know that we've talked about electronics before, and that it's hard when you have a child that might even be addicted to electronics, but what are your suggestions for motivating a child when it seems like they're only motivated by electronics? And I'd ask that any of our panelists, if you can respond to that, to please unmute yourself and jump in.
Hi, Caroline. I have lots of chats with parents about electronics because I think we're all feeling nervous about how much time our kids are spending on electronic devices. And now that school is mostly online or in virtual classrooms, it's even more time. Electronics won't hurt our kids. We need to encourage appropriate use of electronics. What is bothersome about electronics is that it is often in the gaming world, and I'm talking about the video gaming world, it's designed to suck in the ADHD brain. It's fast moving, it's novel, it's instant gratification. And that's exactly what the ADHD brain is seeking. And so it's very difficult for kids and even teenagers to limit themselves on any kind of gaming in a gaming situation, because they're feeding their brain and what it wants. So it is up to the parent or the adult to make some standards and some rules about limiting that type of electronic exposure. There are some really good research studies that have come out in the last 3 to 4 years stating that hours and hours spent continuously doing gaming type activities are really not good for the brain. And whether a person with ADHD is treated with medication or not treated with medication, their overall attention actually declines with the increasing number of hours spent doing that type of activity.
Great point. Thank you for that, Dr. Woods. A couple other questions rolling in here. And this is a great question from Gina Nietzsche. What are suggestions to keep our children motivated right now during the quarantine? Any specific thoughts on, you know, this time that we're going through and how to get our kids excited about school when they're not seeing their teachers face to face, they're not seeing other students, they're you know, I've mentioned to friends, even my non-ADHD child is struggling right now with motivation. So what are some thoughts that our panelists have on, you know, specific to this time?
One thing I would love to add is, you know, it starts from the top. You know, even when we think about in our jobs in any organization, it runs from the top, and your kids will never go beyond what your level of excitement, enthusiasm, and passion is as a parent. So if you really have to be an example of that in your home. My husband and I both work out the home. We have 3 daughters here, one that's a senior in college, one a freshman in college, and then a 9th grader in high school. And we are all techies, you know, but I have to be intentional. I know I lead the charge in that because we're couch potato people. We just want to sit there and not do anything. And we love that. And then we're all like, and mopey. So someone is going to have to be that agent of change in that home. And it's the adult. You know, what is it that your kids enjoy? One of my children love decorating. So now, okay, we know once we get everything done, we're going for a drive and we're going to go look at architecture. Like, I love gardening. One of my other children has a paint project. We got all kinds of stuff going on. And it's not like optional. it's necessary. It's necessary. If someone likes cooking or someone likes to eat, let's cook some different recipes. You're just gonna have to find other things that are taking away so much idle time that's pushing them towards, I have nothing else engaging or entertaining to do. And it's gonna take us. You know, if I'm just sitting down and I'm like, I got things to do, that's not good enough. And so I definitely would say, you know your babies, you know your children, you know what their interests are. If you don't, this is a great time to find out what their interests are and do some things that are different and schedule them in every day. I got my big scheduler. You book those things in throughout the day, something, and y'all all engage in that.
I think another area that is important is recognizing that a lot of times these kids, their day's consumed by school, and then they have a little break and you splurge with electronics, and the world's changed. And so they have a lot of time at home now, and trying to figure out what that looks like, and that the fact they need to understand what their interests are because they haven't developed any others. And one of the things I've challenged a lot of the families that I've been working with is to find and learn about something new you normally don't have the time for. And I think as adults, when we model that for kids and try something new and stink at it, that's hilarious for kids to see their parents be horrible at something. They learn that we can grow, that it doesn't have to be the end of the world. It doesn't have to be perfect. And then see what they enjoy. And for some of these kids that can be so negative about things, the question has to be, what was the least objectionable new activity we tried this week? But helping them to find things that they do enjoy, find things to help them balance that out so that they're not just stuck in the electronics gap. The other thing I emphasize is that you can spend that some time on electronics, but we need to spend at least as much time doing something physical or something that really is involving our brain not on a screen, which actually rules out some of their schoolwork as well. So keeping that in mind of balancing the screen time, because we can't go hour by hour because parents are in different places. When you have to make conference calls, your kid's going to watch 2 shows. And you can't beat yourself up about that. This is a survival mode, but it's being flexible about being able to get off the electronics and rewarding that and finding ways, even if it's earning future dollars for something or little kids pom-poms that translate to something later on, and it helps them to recognize that a little better.
That is a fantastic point. Thank you, Susie. There are other things that we could be doing now related to being at home, just to change things up, things that we wouldn't normally, hobbies or interests that we might not normally have time for. So another question that we had a few minutes ago is related to how can we tell the difference between a lack of motivation versus a difficulty in persevering through a task due to the ADHD? And is there a difference?
I'll take that question. I think that is a good question. From this perspective of motivation, they're somewhere on the continuum. So it really takes away the idea that someone is lazy or they have no desire to be productive. There's no evidence that supports that about human beings. So if they, it's a lot in what they're saying and listening to your students and what they're saying. If they're saying that they're getting tired, or when is this over, or when can I go do this, they're describing that they're having the fatigue of the mental energy being expended. If they're saying, I don't want to do this, I've already done this, why do I have to do this again? Then they're telling you that they're having trouble starting, they're having trouble initiating, which is an executive function, initiating a behavior and being able to sustain the activity on that. So it's very much back to what Wakesha was saying, in conversation and really listening to what they're saying and not trying to predict it or to prevent it, but to just get in the process and realize that In fact, if they were motivated and they started doing something, whether it be because they were avoiding the consequence or they were doing it for reward, they could slip back to being unmotivated once they became fatigued. Okay, so then you have some options of how to re-engage them. You can give them the reward or the restriction. That's what moves people along motivation, is reward and restriction. Hope that helps.
Yes, thank you, Jennifer. Another question is related to, and we are sort of running out of time, but we'll take a couple more questions, I think. Another question was related to a student that eventually they will finish their homework, but has a tough time getting started on the homework, and she's not sure how effective rewards would be, since eventually she does get it done. So it's really the starting the task. And before I pass that to the panelists, I want to share with you something that we started in my home, and you all may already do this. I actually tried this for myself. I work from home. I can't stand doing documentation for my clients. I love working on site with my clients. And in order to get motivated to get into the drudgery of this paperwork and documentation, I set a timer. I set a timer for 20 minutes and I say, okay, I'll just do it for 20 minutes. And once I get started, I'm able to keep going. So that's a little trick that I do for myself, but I'm not the professional. I'm the parent with ADHD. So I'm gonna then open this to our panelists again for that procrastination. How do we help the student just to get started?
One of the things that I think is important with starting things is helping them recognize that it isn't going to take forever, that we can stop and we can start, and we can just start and say, let's see how far you get in 5 minutes. Because a lot of times the fear of these unknowns, it's going to take forever, it's going to take hours. And I think by slowing down and saying, okay, let's do this little bit at a time, and recognizing that. But knowing in reality that having a kid with ADHD work for 5 minutes at a time would be creating so many transitions and probably be counterintuitive. So we're just trying to build that momentum to help them recognize that. If you guys are having a hard time using nice voices, I have a couple of clients that like to use Alexa a lot, and using the app, you can actually program her ahead of time to nag them to be ready in the morning, or things like that are specific, of saying one specific child's name. It's time for you to be brushing your teeth. It's time for you to be eating. It's time for you to be starting. And that really tends to help them recognize, because part of what we're doing is we're trying to help them recognize how long tasks actually take, because that's going to lead to them being able to budget their time as they get older.
So looking at the time and the questions that have come in, it feels like we're at a good place to wind down. So if we have any final thoughts from our panelists, now would be a good time to share those. Do we have any?
I have one more thought before I manage to mute myself again accidentally. I don't have great internet, so I have to kind of come and go. But with the response of fear or other obstacles besides just being straight motivation, I think it's really important sometimes to stop and ask them, what do you think is standing in your way of being able to complete this task? Sometimes kids know stuff we don't realize they know, and know more than we know. And so helping them to recognize that. But that often is a question that I'll ask, or what do you think you need to be successful with this? Because I've seen you be successful in other things. Instead of how come you could do this yesterday and you can't do it for me today, but recognizing that the behavior is a response to what's going on inside them, not a response to what they want to torture you with. And I think that helps us to not take it personally, which is really hard, especially when you're spending 24/7 with all the same people.
Mm-hmm. Mm-hmm.
I think that's a great point, Susie, that we shouldn't really assume that we know how our kids feel about doing a certain task. And I think it is pretty safe to assume that they feel that a task that they don't want to start, and they don't want to start it because it seems too difficult, it's going to take too long, they don't know how to do it, they're too tired to start it, whatever the reasons are, that it's important to ask them what those reasons are, and then validate those reasons, but help them problem solve that reason or the reasons they think they can't start.
I definitely agree. I would say breaking it down, and that's just so simple, you know, breaking it down. Okay, you have this thing that you need to do tomorrow. So let's break it apart. What would you have to do first? What would come next? What would come next? And then once they realize what it is, then the next day just tackle it bit by bit instead of looking at the whole thing. That's one thing I would definitely say, and that can be applied to anything. It can be applied to us when we've got a laundry room full of laundry. You know, let's take it one load at a time and just have that mentality with our kids as well.
I just want to say thank you to everyone who signed on to be with us. I'm sorry that the sound quality and video quality wasn't maybe the best, but I think we'll work on those things. It gives us as a group additional tasks to come to terms with. So thanks to everybody.
Mm-hmm.
Yes, agreed. Thank you, Dr. Woods. I will echo that. Thank you, everybody, for joining us. Thank you for your feedback. We'll be improving as we learn more about the technology. Please plan on joining us again. We'll be sending some more information out, and we're looking at different topics around ADHD that are relevant as we head into the summer months. We'll be sharing more information, so please, we'd love to hear your feedback. If you have my contact information or Kate's or any of our panelists, please share your feedback with us. And a big thank you to our panelists, Jennifer, Wakesha, Sheila, and Susie. Thank you so much for sharing today and for the preparation and time you took. And thank you, Kate and Camperdown Academy, our hosts. And that's all we have for tonight. Again, we appreciate it. Thank you for your participation, and we look forward to seeing you all again soon. So enjoy the evening and have a great rest of the week. Good night.